What I've found interesting that you mentioned in today's call, as well as the last call that we had, is the tests that doctors run for hyperhidrosis, because I haven't really heard much about it. Actually, last call was the first time I heard that people ran tests. I
They
just thought
do
that,
they do conduct medical tests
hmm,
to ascertain or rule out any possibility of any underlying cause. Because you
mm,
see, a lot
mm,
of people may think that their sweat is more primary, which may be the case. You have primary,
mm,
but what if you have heart issues? What
yeah,
if someone who's born with heart issues, heart defects and such issues, the side effect of the underlying medical cause is excessive sweating, but more secondary.
yeah,
And then there are people who are diabetic. You
mm,
know,
mm, mm,
there are certain
yeah,
infections that can lead to excessive sweating. There was a doctor who asked you whether you sweat excessively at night, because night sweats could be a sign of an underlying medical cause.
yeah,
But mostly you have to sweat through your whole entire body. Sweating on your armpits only at night, that it's not necessarily a huge issue.
mm-hmm,
But when the whole body sweat, especially larger areas of the body, that could be a sign of an underlying cause. So we are looking
mm,
at secondary factors. So
mm,
there are some basic tests that they do conduct. They will send you to a lab. They will take your blood. They will check for your blood sugar. They will also test your stool, and urine.
mm,
They will also they will also check your heart, for irregular heartbeat. They will also test for infections, the likes of H. pylori, typhoid. Because if you have typhoid, now most doctors, there are doctors who are very direct. When you show up at their practice, especially with general physicians, the first thing they do, they will ask you whether you've tested for malaria, because malaria, people who have malaria or any form of infection, their body temperature gets affected.
mm, mm.
So the change of body temperature, they tend to sweat a lot. Have you ever seen someone who has cholera? They sweat a
No.
lot. They sweat a lot before they start, going on a diarrhea mode. They sweat a
Mm,
lot. So the first thing they do, they will approach it from an infection perspective.
mm, mm.
But when they ask you when did your excessive sweating start, and you tell them that it started off at, early childhood or at teenagehood, then the first thing they do is conclude. Then what you have is primary focal. We have Botox, we have this and that and the other.
Mm, mm,
So
mm.
they're
Yeah,
supposed to take the client step by step and sit down and have a treatment plan, you know, before we go straight to oral medication, which is not a beta blocker. It does not target the area of focus. You can start with the topical treatments. And then if you're not getting the results you're looking for, then we can move to the next level. And for each treatment, they need to explain and they need to go in depth when they're explaining all these treatments to their clients, for them to, once they leave that practice, they have a better
make an
understanding.
informed decision. Yeah.
Yes, they're informed, and now they can go and decide for themselves, you know what, I want to start with topical treatments as I plan for these other levels of treatment
Mm,
based
mm,
on the
mm.
effectiveness that I'm receiving. you know. So testing
Yeah.
for underlying causes is very important. Like there are those
Yes.
who have been tested for anxiety and they were found to have clinical anxiety. Some had anxiety disorders, you know. And anxiety, it's not an easy thing to treat, because
Mm.
this means you have to go inside that person's emotion to go and locate where anxiety is and be like, anxiety, can you bring your behind here? It's the most difficult thing to manage. So
Yeah.
you have to approach it from a holistic perspective. You have to sit down
Yeah.
with the client. You have to
That I
talk
think
to
is
them.
lacking. So I
Mm.
think information like putting out information like this is like very empowering to people with hyperhidrosis.
Mm.
You know what to look out for, you know what is a red flag and what you need to run away from. So yeah, I really appreciate that. Yeah.
I think the next topic we'll talk about that.
Yes. And also, I think an important thing, this has been discussed before, there's nothing new, but while you're trying all these treatments, right, you're still sweating. So I think you also need to think about how do you manage sweat then.
Mm.
And another thing that I wonder about a lot is uh, for people that plan to get pregnant sometime in the future, they need to put an end to these treatments. You're
Mm.
not supposed to be taking treatments with your interfaces device when you're pregnant. You're not supposed to be taking oral medications or Botox when you're pregnant. So I think that is something that I wondered about a lot, but I haven't really seen much information around. Like,
Actually, I had the same conversation with Dr. Hashim, and
mm-hmm,
I'm going to do a video about it because apparently, when when a woman is expecting, when they're pregnant, they're not
mm-hmm,
even supposed to use topical treatments during that
yeah,
period. And even after they give birth, they need to wait until they're off breastfeeding. That's when now
mm,
they can proceed in using topical treatments. Or if they must use topical treatments, they have to use a brand that is unscented. So meaning you have to apply the PM version. You have to
mm,
apply, but you need to do it. You have to do it you need to be careful. You need to approach it very carefully because
yeah,
anything you apply, it has the tendency to affect your baby.
mm,
So
mm,
most
mm,
doctors will advise that during that period, do not apply anything when you're expecting. And even after giving birth, wait until you're off breastfeeding. Or if you're going to use, go for a brand that doesn't have a higher active ingredient
yeah,
percentage, especially brands which the active ingredient is aluminum chloride. Use a brand that has a lower percentage. So we are talking of 12%. Don't go for anything that is 20%. And it doesn't
yeah,
have to be scented, it has to be unscented, you know.
mm, mm, mm,
So there are
mm.
nuances to it. And I'm planning to do a video on that particular topic.
Yeah.
It's,
So like,
I've
what
been
sorts of
having.
things you need to look out for when you're like,
Mm,
trying,
mm.
and like, is there any other way, uh, or do you just have to stop everything cold turkey? Like, some,
Well, the when when a woman is expectant during that period, the 9 month period, there is a
mm,
lot of changes in terms of hormonal changes.
yeah,
So there are instances where the excessive sweating may reduce, and there are
mm,
instances where the sweating patterns may not be as they were before. So there
mm,
are certain times when they may experience a lot of sweat. There are times where the sweating has reduced. So again, the change in the home, this is where now the hormonal imbalance thing comes in. When you're
yeah,
expecting, you're not going to be the same person for the next 9 months. There's a lot happening. This is
yeah,
why it's very important any type of treatment that you go for, whether it's a prescription medication, even a painkiller, you need to be very careful. It has
yeah,
to be, it has to be under a very strict prescription. So it's a whole video on its own, which we had that discussion. But yeah, I'm going to do a proper video where I'm also going to invite a doctor, a
mm,
female doctor who
mm,
has attended to women with, pregnant women, and also invite, an expectant mother and a woman who has given birth, and for them to give
yeah. I
us
think
that
that would be
idea.
very helpful.
Mm,
Because I used to think, I mean, I think about this a lot, and yeah, I found someone online who, very casually they dropped that, they have hyperhidrosis, and in a video or something. I think they were a YouTuber, and I was just so desperate for information that I DM'd them several times, you know asking if they could like share their experience with me. They were, they just had a kid or something. So I think it would be very helpful to a lot of people to have information around this from a credible source, and also like how, not just information, but how do people deal with it when they're pregnant, and also they have hyperhidrosis and they have to quit all the treatments because it takes a physical toll as well as a mental toll, right? So I've read that even those without hyperhidrosis, people without hyperhidrosis, when they get pregnant, they tend to sweat a lot.
Yes, they do.
Those 9 to 10 months. Yeah. So
Yes,
it's like, does it get added to that? Again, it's a uniquely individual experience. It's going to be an individual experience, right? Anything, but yes, information around that would be like much appreciated. I think a lot of people would really appreciate it.
Darini, thank you very much. This has been a very exciting conversation, and you've made our sweat confessions very, very, very interesting, and we thank you for that. Thank you very much. And have an awesome weekend. How do you say goodbye in in Japanese?
Sayonara.
Whatever she said.
Whatever I said.
I approve the message. Thank you very much.
Thank you so much, Martin. Yeah, I really value and appreciate the work that you're doing, creating content around this and raising awareness. It's really important. It's very empowering. So keep up the good work. If something comes up in future, I would love to get on another call with you and do another session of sweat confessions. Talk about situationship.
Welcome to the situationship.
Yes.
Anytime. Thank you very much, Daria.
All right. Yeah. Thank you.